So growing up, things like flossing were not covered. We weren't taught to floss. We weren't taught all of these things that now, kids grow up doing when they're 5, 6, with their parents. So I missed out on, just because of how old I am, I missed out on a lot of preventative care. So the dentist wasn't, it was like really basic. In the 80s, when 70s and 80s when I grew up. When I got into my 30s, late 20s and 30s, I started having dental problems. And partially a result of not flossing and having those great habits, and partially genetics with periodontal disease. And I started to have really bad experiences at the dentist. In fact, one that resulted in so much PTSD that I didn't go for about 5 years. I started getting concerned about the overall health of my mouth when a colleague of mine, who was maybe about 5 years older than me and I was in my 30s, had emergency open heart surgery because of gingivitis, because of bacteria in the mouth. So he got sick, thought he had the flu. The next thing you know, thanks to a resident who looked at his fingernails, no one else had assumed that was the problem because he was a young guy in his 40s and he was healthy. He had open heart surgery and he's since passed away. So that was a real big catalyst. Yet I didn't take action right away. But what I did do is I started paying attention to information about the health of your mouth and how it impacts the health of your overall body. And when you do that research, you take action really quickly. So when I got really serious about taking action, I had just moved to Reno, so I didn't have a referral path. I didn't have a doctor that I could ask, to direct me to someone, which might have worked out in my favor, I think, because I had to do a lot of deep research. And what I noticed in my conversations with various practices was the information that was shared with me was not personal to me and my experience and the questions that I was asking. It was, I felt very much like it was, there was a step-by-step process for these practices, and you had to fit into the way they operated, and there was like a holding back of information, not because they were trying to be deceitful, but I feel like it's because they didn't think I needed to know. But I'm a curious patient, and I know that good outcomes come from shared decision-making, which means that as the patient, I have to be educated. And then the practice team needs to educate me too, so that we're all on the same page. And I didn't feel like that was the case until I came here. I prioritized my overall body health over cosmetic. And I'm not saying that one is better, or more important than the other. I mean, your overall physical health is really crucial. Like your mouth will continue to experience problems and it'll cycle through your body. But I don't want to diminish the impact from a cosmetic perspective, because that helps with self-esteem and self-worth and feeling confident that you can go out in the world and do the things you need to do. But what I'm surprised by, having gone through the procedure, is how much clearer my head is, how much more rested I feel in the morning when I wake up. My thought processes are faster. Like I feel like I was dealing with a lot of infection, and realizing, seeing on the other side how different I feel mentally and how much better my focus is and my quality of sleep, I'm both surprised and mad at myself that I didn't do it sooner. Finding Reno dentures and implants was what it really underscores the importance of doing your research on the practice. Meeting the people, definitely, but also understanding how they operate. It doesn't mean in any level of detail that would be beyond a patient's ability. It's just paying attention when you're in a consult. And this team it's like a well-oiled machine, but I don't want that to be interpreted as like this super big medical practice, like you're affiliated with a hospital or something like that. It's a well-oiled machine because the team works so well together. And everything that everyone said was consistent throughout the whole process. So the outcomes, I felt so relaxed. I felt relaxed when I went home, knowing that if anything happened, that you all would be here and that it wouldn't matter who I spoke to, I would get the same consistent information, And so I feel like the work that you do, especially given the fact that I had such intense dental PTSD, the work that you do is amazing. And I'm not aware of what you're doing in my mouth. When I say the work that you do is amazing, I'm talking about the way you interact with patients and the way the team, is like a mirror for each other. That there's this consistency that makes me as a patient feel really safe and well taken care of. And I think that directly translates to the outcomes, which in my case translated to a virtually pain-free experience, which is just shocking to me. I was surprised also I was conscious during the procedure, which wouldn't have been my personal choice, and I'm so glad I was. It worked. I wasn't stressed. I didn't feel anything. And this is coming from a person who would be like sobbing before I got to the dentist, like already in a state of, absolute meltdown. None of that happened. And the procedure itself felt really straightforward. I'm sure from maybe your perspective, it's not, but as the patient in the chair, I felt, again, consciously sedated. I just still felt like it was a really straightforward procedure. And it felt like it went quickly. So that, again, kind of contributes to a sense of security. And that was part of my criteria in looking for a practice. I didn't want to be with a practice that occasionally did implants. I wanted to be with a practice whose primary reason for existing is to do implants. And that means to me that you see it all and you've dealt with it all. And so when it comes to me, I'm probably not going to be some kind of edge case situation. And so you'll know what to do, no matter the outcome. So I was really surprised by how straightforward, simple the procedure was. And I was also equally as surprised, even though I was taking pain medication, I was equally surprised at how little discomfort I experienced. It was about 10 days of discomfort, and then a very quick sort of accelerated improvement, like at the 10-day mark. And so when I think about the work that you did, I find that remarkable, that within a 10-day period of time, I felt normal.